Hi, and welcome to episode 6 of The Skin and Stitch, a podcast following two friends in their journey through medical education. I'm John, and today I'm joined by my co-host, Mahak. Today we will be discussing the consequences of American healthcare's reactive focus and some very basic proactive ways to keep your body healthy. We're excited to be back.
Welcome back to episode 6 of The Skin and Stitch. We all know that our lovely and amazing followers are waiting for our reunion. And so today we're going to be talking about a little bit about social media and how it overwhelms us with skincare tips. Wait a minute. Don't we usually do this is your host, Mahak Sharma and John Winton?
We can do that now.
Okay.
This is your host, John Winton.
And I'm Mahak Sharma. And today we're going to be talking about how social media overwhelms us with skincare tips, from viral hacks to influencer endorsements, which can make it very challenging to identify evidence-based advice. And the U.S. healthcare system has traditionally been reactive, but a shift towards preventative medicine does emphasize stopping illnesses before they become difficult to treat or even untreatable. So we hope you enjoy our segment today.
Yeah, get that on a t-shirt. Okay. What are you drinking? Do you have a drink?
Actually, I don't. I just have plain water. Oh, you can't see it due to the fact that my background.
You have to put it in front of yourself.
Oh,
yeah, there we go.
So I actually went to Seattle a long time ago, and I went to the Starbucks Reserve there a long time ago. But
I was wondering why it said C.
C. Oh yeah, it says. Oh yeah, I guess it's a thing for Seattle. But anyway, I'm just drinking water from this old water bottle.
Yeah, same. So I went to the dentist actually, and I got told that I should drink more water, even though I drink 1.5 liters a day, for the information of everybody listening.
Okay.
It's supposed to be 2 though. But
you're supposed to be later. Yeah, more about that later. Actually, I have a question to ask you about that later. I thought of it today.
Do you want to ask now, or should we wait?
No, we should wait.
Okay. All right. So I'm going to start us off with a little statistic.
Mm-hmm.
According to the Center for Disease Control, 90% of the nation's $4.1 trillion in annual healthcare spending is spent on chronic and mental health conditions. And these conditions can often be mitigated or even avoided with preventative measures like healthy lifestyle, regular and comprehensive health screenings, as well as early interventions. So I think there's been a lot of talk in the news about how to save money, and, I think everybody in the country is worried about the growing national debt and stuff, right? So we have this huge sector of our economy that is devoted to things that could be prevented earlier. So that's what we wanted to talk about today.
Yep. And I think that this kind of encompasses a lot of different topics. So like if we talk about general topics under national health conditions, that includes food safety, environmental protection, like alcohol control, tobacco control. And by control, I mean risk of cancer and liver disease and things like that. And so today we're going to talk, I think, more about health education in general, and maybe some common harmful habits. So there are a lot of broad topics to cover, and we're just going to cover kind of a small section of those topics about little factoids and things that we found interesting.
These can be very surface level, basic things that anybody can implement into their life.
Exactly. So what'd you say?
High yield.
Small things that you can do to improve your daily life. This is not something, that's incredibly deep or profound, although I'm sure we'll get into those topics. I wanted to preface our audience.
I wouldn't say that. We might get deep and profound.
Okay, well, I'm going to get started with a simple example on sunscreen. So despite, widespread awareness of sunscreen's protective benefits, most Americans still fail to use it consistently or correctly. So, a study done by the American Academy of Dermatology actually found that only 14% of men and 30% of women apply sunscreen daily, with only almost a third of the population, like adult population, using it regularly year round. And so while 54% of their survey respondents did say that they report using sunscreen sometimes, only 23% of people applied it on cloudy days. And I think this gap in sunscreen use and application is concerning because we do see that regular sunscreen use with an SPF of 15 or higher does reduce the risk of squamous cell carcinoma by approximately 40% and melanoma by 50%. And so I think Americans skipping sunscreen while indoors or while in cars, even though 80% of UVA rays can penetrate glass, does contribute to long-term skin aging and cancer risk. And this is something that we do daily. You know, I was talking to a dermatologist and she told me a lot of people don't know, even during wintertime, when sun reflects off of the snow on the ground, it can actually cause a sunburn, which is like, you just like don't think about these things. But then, I mean, I'll be honest, I don't apply sunscreen, you know, when it's a snowy day and I'm going to go outside. That's just not
You
something.
apply sunscreen daily?
Yeah, I mean, in the summer.
100% honest.
100% honest, my products also have sunscreen in them. So like in terms of like, you know, if you have a moisturizer or something you use, it has SPF, whatever, blank. I do use it in the summer for sure. That's the truth. But no, I mean, in the winter, do I think of putting on sunscreen? No, I don't think the average American does either, which is supported by these studies that I mentioned. And then, you know, accumulation of this damage, I don't know what your thoughts are on this, John, over time, I'm sure would lead to some unfortunate circumstances and contribute to negative health effects.
Yeah, I mean, so I put sunscreen on my face daily throughout the entire year.
Okay.
It's like the last step.
Mm-hmm.
Right after I get out of the shower,
Okay.
I do lotion and sunscreen.
Okay.
But I don't put sunscreen anywhere else on my body, not my arms, not my legs. During the summer, I don't either.
Oh.
Only if I'm going to the beach.
Oh no.
No,
Well,
I don't think I think that's incorrect.
I do think that is an incorrect method of applying sunscreen. I also like, do you put it on your neck at all, perchance?
No, it stops at my chin.
That's the thing.
Hey, let me write that down. Mahak.
Yeah. Mahak's note of the day: apply sunscreen on your neck. Too.
All right. Sounds great. Yeah, but I mean, you're interested in dermatology. I'm interested in plastic surgery. There's a lot in both cases. There's a lot of stuff about melanoma, right, and skin cancer.
Mm-hmm.
And it's pretty common.
Mm-hmm.
Less common than maybe some countries like Australia or something, but it is still pretty common. And I mean, it can get pretty bad, right? If they need surgical excision, then it comes to plastic surgery sometimes. And some of the cases are really gnarly. We just had a gnarly one a couple of weeks ago.
Really?
But anyway.
Yeah, I mean, melanoma is the deadliest form of skin cancer. So that is, wait, what'd you say? Sorry?
Sunscreen can prevent it.
Yes, so. Sunscreen prevent it. This is a side note that I'm just thinking of now. Like every year, you know, like, do you check to see if your sunscreen is expired or not? You know, I'm sure it's not as effective once the expiry date is passed. And those are small things. Like I just went to the beach, like 2 weeks ago. And when we got to the beach, we realized the sunscreen had expired in 2024. Okay. You know, it's just like not in common practice, I think, in a lot of households, even in like among students who are interested in dermatology, or, you know, where you learn about a lot of these things, to check the sunscreen bottle, check what SPF you need, or how high should it be for you to actually get protection? Are you covering all parts of your body? Things like that. I mean, my mom, she's recently started using these covers. So she puts this like white cover on her forearm when she's driving. I don't even do that. I'm like, Mom, this is so innovative. Not innovative, but I'm glad she's taking the initiative to do these things.
Extreme.
Yeah, I guess so, and it's good for you.
So
So,
let me ask you, what are your thoughts on the people who are like, I have to get tan. I have to sit outside until my skin burns, and then, it'll look good the next day. And if there's not enough sun, then I go to a tanning bed and stuff like this.
okay, I will tread carefully because some of my closest friends love the tanning beds and they love tanning. And so I will say, I think a lot of times people are not aware of how severe or how serious a situation can become until it actually happens to you, right? Like you think, oh, this thing is really bad, or oh, like, well, I don't have to do this. Like, I don't have to worry about this because you don't see the effect of it in your daily life. And so I think a lack of exposure, maybe as medical students, we do see a lot of these cases, whether we're shadowing or we're in clinic or we're learning about it in school. So we know about like certain pathways that actually cause DNA damage, right? Or things like that, which are actually happening while you're tanning. But somebody else who's maybe not in the field of medicine doesn't really know that. And so I think if you do not have the knowledge to know why something is bad for you, why would you fear it in the first place? And so I think that's kind of my take
That's
on it.
where we come in and we educate people.
Yes. First, we
All
must
right.
do things ourselves, though. Anyway, next topic.
So I'm going to bring up something that was a big area of my research experience.
Mm-hmm.
Not so much anymore, but I used to do sleep research and
Mm-hmm.
neurology research, brain research. A lot of it was focused on sleep. And
Mm-hmm.
so being in a sleep lab and doing sleep research, that's when
Mm-hmm.
I realized how important sleep was. Before that, I wouldn't really sleep that much. Now I try and keep, the same schedule, sleep at a predictable time and wake up at a predictable time, preferably pretty early. So we, according to the endocrinology and metabolism clinics, there's a lot of relation between irregular sleep and disruption of circadian rhythms, glucose metabolism, cortisol levels, which are, related to stress. And so there's all these connections between bad sleep and things like obesity, insulin resistance, and cardiovascular disease. As you know, all three of these are extremely prevalent in the United States, right? And so there's something so easy about getting your sleep schedule together, and you can reap so many benefits from it. So I think that's another point. When I went to a sleep conference about a year ago now, one of the speakers said something which I thought was really interesting, was that a lot of times different problems in your body first manifest as a problem with sleep. But the thing is that there's no standard for asking about your sleep when you go for your yearly physical. A primary care doctor is not specifically told to ask, how have you been sleeping? Do you have any sleep difficulties and stuff like that? And I think that's a really important part of somebody's health. You spend a third of your day doing it, right? That's a really important part of somebody's life and their health that the American healthcare system, I think, overlooks a bit. So the moral of the story is to sleep better.
Yeah. And I think it's like small things like this which are overlooked. Like, oh, I'm studying for an exam. I'm going to stay up late into the night, or which, like, we understand, right? Or, I really like when I am done with work, I come home and like I need my wind down time where I'm on Instagram Reels and I'm watching, like an hour of these Reels before I go to bed. And it's just a routine. Like I do this every day. What do you mean? I watch TV. I have a TV in front of my bed. I just watch some show and I go to sleep. But then, yes, sleep is important because, and correct me if I'm wrong, because you have done significantly more research on this than I have in terms of sleep. I learned that sleep actually like impacts your Alzheimer's risk too, because like sleep is like a cleansing system, right? And so like essentially I think slow wave sleep is specifically very important for memory and brain detox, right? As they say. And so if you have accumulation of poor sleep for years and years and years, I'm sure that you would experience some sort of cognitive decline or issues of memory consolidation, which could impact your risk for Alzheimer's.
Yeah, basically, sleep is the time that your body has where it does not need to use as much energy on you doing daily life stuff, and you can use that energy for things that you have no control over. So, protecting your body from different viruses or things like that, fighting off some sort of infection, consolidating memory, as you said. So there's a lot of stuff, that's why they say get a lot of sleep when you're sick. But I think it should really be get a lot of sleep all the time.
Yeah.
Not that everybody can do it. I mean, we're in med school and that's not always possible.
No, it's not always possible, but I think when you can, you should try to do that. And I think a lot of times, like I've noticed, I have to use these apps to stop myself from going on my phone because it's like you go to bed and you're like, oh, well, so my friend sent me all this stuff, right? So social media also plays a big impact on that, although that's a already heavily discussed topic.
Yeah, I will say one of the things that has helped me extremely with my sleep schedule is a sunrise alarm clock. So I have this one from Philips or something, I don't know. Basically, 30 minutes before the scheduled time, it starts like glowing.
Oh my God.
And it's like really soft at first. It mimics like a sunrise, right? So it's red at the beginning, and then it goes, and then at the time it's like really bright white. So because your circadian rhythm is not really linked to time, it's linked to light levels, right? So usually I wake up from the light and I open my eyes and it's like, whoa, it's like so much light in my face. And it actually does. I used to snooze my alarm clock and go back to bed and stuff. And now I actually don't have to do that.
Oh, wow. Okay.
Yeah. But I mean, once it hits the time, the noise still goes off. But a lot of times I find myself waking up before that.
Okay. Very cool. So let it be known that you can go to extreme measures like so if you really have a problem. But no, that is an innovative solution because I know myself included here. It's very easy to snooze your alarm and then, push it 5 minutes and such. But I will keep that in mind.
And I mean, it's summer now, but I think especially for the winter months when you wake up for class or something and it's completely dark outside and nobody wants to get out of bed, right? So yeah. I'm banking on that helping. I think it's going to help.
I think it will help. We'll
see. I'll update you guys. 6 months update in December.
Sure.
For episode number like 100 and something.
Sure. We'll put that on the list.
Okay. That's all I had to talk about for sleep. Do you want to take the next one?
I really want to talk about this chronic dehydration. And so, John, let me ask you a question. This is what I was talking about earlier. No, it's a simple question. Yes or no. So do you think that, let's say, like 135-pound, 5'2" female requires the same amount of water as maybe 170 or 180-pound, 6'2" man or male?
The answer's got to be no, right? It's got to be different amounts of water.
Yes, the answer is no. It's got to be different amounts of water. No, the reason I say that is because from a young age, what I learned was you have to drink 8 cups of water a day, right? It was like, you have to get 8 cups of water a day. And that was all that was.
2 liters, right? Or half a gallon.
Sorry, say that again?
2 liters or half a gallon, right?
Yeah.
Same.
Sure. So I don't really know the liter to gallon conversion, but I'm sure that's correct. Maybe you should search that.
I just looked it up on Google, so confirmed.
Perfect. So, right, you should be getting 8 cups of water a day. That's what you're told, when you're growing up. And that was told to me in school. That was told to me like by my parents. Obviously, that was just like a standard metric,
Yeah,
right?
it was told to you by me actually 15 minutes ago.
Exactly. You just said that to me 15 minutes ago. My point is 8 cups of water is not sufficient for somebody. Like you can't say a male or a female or somebody who weighs this much or somebody who's this height or somebody who's super athletic and they're working out every single day versus somebody who has a very, sedentary lifestyle requires the same amount of water. And I think by saying, and I know the reason for saying eight cups of water a day is to get people to drink water and to say, okay, you should at least be getting this amount, right? So
Yeah, like your goal.
like a goal to have. And I understand that. And I think that's okay. But I think teaching people from a young age, like, hey, when you're older and you are going to be, whatever height and whatever weight and whatever your lifestyle is, that is going to play a large role into how hydrated you need to be during a day. I think that's like a super important conversation to have. And the reason I'm laughing is because, so my brother, he works out a lot, like constantly. And the amount of water that he drinks compared to me in like a daily time period is significantly different.
So
And
he drinks a lot of water.
he drinks a lot of water. I mean, I tell him to drink a lot of water, but he drinks a lot of water. And anyway, I don't want to go on that for too long. What I want to talk about is chronic dehydration because it's so overlooked and it contributes to systemic disease. So even mild hydration increases vasopressin levels, which has actually been linked to higher risk of chronic kidney disease, hypertension, and insulin resistance. And an NIH study from about 2 years ago found that adults with higher serum sodium levels, which means you have low hydration, actually had a 21% greater risk of accelerated biological aging and chronic disease. And so things like inadequate hydration impair your thermoregulation and cognitive function at even just 1 or 2% of body water loss. And obviously, chronic low water intake can lead to systemic inflammation. It can lead to disease progression. And despite all of this, right, there's all these studies and we know all of this, over 75% of Americans fail to meet daily hydration recommendations, which is your recommended whatever they tell you. And that actually might not even correlate to your daily lifestyle and what you need to be actually drinking. And so I think this is incredibly important given the rise of also coffees and like these little hydration drinks and all these things that are supposed to boost your hydration, right? Just drink water and drink enough.
Well, even stuff that like the US obviously has a big soda problem, right? You can go to the grocery store and a 1 liter Pepsi or something could be cheaper than the same amount of water. It's crazy. And people are replacing hydrating with, teas and juices and all this stuff. It really can have the opposite effect, right?
I think it's enticing to somebody. It's a hot summer day. You walk into like whatever, a gas station or something, and you see a $2 Diet Coke right next to a $3.49 water bottle, right?
$3.49 water bottle. Are you getting Evian or something?
No, you're getting basic, I don't want to say brand names. I don't know if we're allowed to say brand names, but you're getting a basic insert brand name water bottle and it's costing you $3.49 compared to this Diet Coke, which isn't going to cost you the same amount. And that's actually
guilty. I sometimes get
that's what I'm saying. Yeah.
Sweet drink.
I do too. Yeah. Cause it's just like a hot day and you want something cool. But if you like really think about it, okay, if somebody, maybe someone doesn't have the funds to necessarily like make consistently healthy choices all the time, that can be very difficult for someone. And so whether it's, hey, I'm making this choice to take a cheaper alternative because I find it refreshing, or I actually can't afford to consistently consume healthy options for myself every single time I stop somewhere and I need something. Both those situations are incredibly unfortunate in my eyes.
Yeah. So let it be known, it is important to check how much water you're drinking. One way to do that is to check the color of your pee, right? So important. There's usually like a chart. You can go on to Google and look up, pee chart or something.
Yeah, I think you can be overhydrated though. If it's like clear completely, then you know that you've drank too much water, I think.
Yeah, but I feel like that's a better issue to have than underhydration, right? Just to an extent, right? Obviously,
Yeah.
water's bad, but your body can can get rid of water easier than it
Yeah.
can.
It's easier to make up for a water excess than to
Yeah, yeah,
or water
yeah.
loss. Um, yeah. Okay. Well, that's all I had to say about water.
Yeah, so I'm going to bring up. So you've got a derm example that you brought up earlier, and this is
Mm-hmm.
something that I've learned about more since I've started shadowing in a lymphatics clinic.
Mm-hmm.
And so I'm currently doing lymphedema research.
Mm-hmm.
It's a quick blurb for lymphedema would be it's a disease that you can get due to trauma. So if you hit something really hard, radiation, surgery, anything that disrupts your lymph nodes,
Mm-hmm.
then you can have dysfunction in your lymphatic system, which leads to the fluid in that system not being able to drain out of usually a limb, occasionally in your trunk or your main chest area.
Mm-hmm.
And so in other countries, it's called elephantiasis, where they have a really big limb, and usually it's fluid, and it can progress and become fat deposition. And it's really hard to deal with, and there's no cure still.
Mm-hmm.
And so, what they tell people when they're at risk for lymphedema, or even just in the early stages of lymphedema, there's no cure, right? So, what you want to do is to make sure that the fluid is still moving. And so the most important thing that people will say is to wear compression socks during high risk activities or, compression sleeves, depending on where the area of risk is. And so for example, compression socks when flying. I'm sure if you go into like one of those airport stores that sells the candy for $6, they sell compression socks, right? And
Mm-hmm.
I'm sure it's some gimmicky, like not compression. But if you can get actually good compression socks, I wear them after I started learning about this because I don't want lymphedema. I wear them on the plane. And when I go and shadow in the hospital and I have to stand a while, and it makes such a difference, I have to say, because, normally when you get on the plane, right, everybody kind of feels, especially if you like, I don't know if you're a person who takes off their shoes on the plane or not, but if when you get off the plane, don't your shoes feel smaller and tighter?
Mm-hmm.
And it's because of all that fluid, because you've been sitting there for so long. It's like stuck in your legs.
Mm-hmm.
There's no heart of the lymphatic system that's pumping around the fluid, right? But if you actually can find good compression socks and wear them, your legs feel completely fine. And when I did that, it was like magic. It was so nice
Really?
because
I've
it's
never
not
tried to do that
uncommon for
before.
your feet to grow half a size or a full size, right? While you're sitting there on
Yeah.
and so it gets rid of that. And even when shadowing and stuff, it gets rid of the fatigue that you feel, which is that your legs are heavier and stuff. So
I'll have
that's,
to give this a try. I've never actually tried to do that.
yeah, important prevention tip if you don't want to
Yes.
get lymphedema.
Wow, that's actually very interesting. I did not know
They
that.
don't look sexy or anything. I feel like when I wear it and it goes up to my knee, I look like Pippi Longstocking or something like that.
But no, you're
Uh,
making this conscious decision to prevent something in the future from happening. I did not know that prevent wearing compression socks could actually prevent your chances of lymphedema. That is wild, John.
so
I'm
pretty
actually
cool.
well, because in school, what we learned about planes was this classic clinical correlate, which is somebody's in a plane for a long time, and all of a sudden, like, they have a DVT or a pulmonary embolism because they've been sitting on the plane for hours without any blood flow in the legs, right?
Right.
And so that's the extent to my knowledge on wearing compression socks and having, like these issues on the plane, which are also horrible.
I'm sure it's all related, right?
Yeah,
The
yeah,
fluid's not being moved out by the lymphatic system, so it's hard for blood flow to get there and stuff, and blood sits there too.
well, But yeah, that's actually pretty cool. So you're saying that you wear compression socks, sorry, ever since then, and it's actually impacted your life.
Feels so good. I can get off the plane and it everything feels perfectly fine.
Yeah, you don't really feel like kind of heavy and weighed down.
Yeah. That way, the most important thing, you got to get to the immigration line. You got to get there fast.
You
You
have
don't
to get
want to
there
wait there
fast
for an
with
hour,
everyone
right?
else. No,
So now that I have the compression socks, I'm booking it.
exactly.
Everybody else is like trying to figure out whether their feet are bigger or not. I'm
Yeah.
already there to show them
Everyone's
my pass.
barely able to walk off the plane, but you're actually already first in line.
I'm halfway to the city in a taxi.
Exactly. So if you're not doing it, you're checking in at the hotel and someone's still on, they're trying to
They're
get
still
off the
getting
plane.
row 23.
Exactly. You were in row 38 actually, and you still made it out faster.
Yeah. Okay.
Okay. Got it.
So we have a bunch of examples, and I'm going to make a plea from the physician side. Actually, do you want to take this?
Yeah, I can take this. Why did you were going in so strong? I was ready to listen to what you had to
Yeah,
say.
but I didn't want to hog it because I just said the previous point.
Oh, okay. Well, that's okay. I can talk a little bit about it and then you can chime in. So, dealing with all of dealing with chronic conditions, right? So, when your patients come in and one after the other, you have chronic conditions that you're looking at and you're explaining to somebody, you're educating them on all these issues can actually contribute to physician burnout, especially in primary care fields. And so, according to an article in JAMA, burnout estimated to cost the healthcare system at least $4.6 billion annually, with the greatest burden attributable to turnover and work hour reductions among primary care physicians. This is a very, very important topic to hit because I think there's a lot of talk of physician burnout and wellness and mental health, but what it really stems from is what kind of conditions you're looking at consistently, and how that's impacting your mental and emotional health. And so if one person makes a small decision to improve their health for themselves, they're also contributing to something much larger than themselves, is what I think.
Yeah, totally agree. I think especially because, as with all developed countries, the United States is slowly getting older and older, right? The aging population is a real issue, especially for countries like South Korea and Japan, but also for the United States, right? People are always worrying, is there going to be Social Security money left when we retire? Who knows? I mean, we're paying taxes for Social Security. Who knows if we're gonna have any? But anyway, so as people get older and the population ages, obviously you get more chronic conditions and conditions that you can't really cure, and you just have to treat as you age. And so I think it's going to become a bigger issue in the future, and that's why preventative care is so important now. It's not the norm in the United States, but I think it has to be.
Yeah. I absolutely agree. I also think you talked about the aging population, we're thinking of how many incoming new physicians are choosing geriatrics, right, as their specialty. Is there going to be, obviously, as medicine gets better, people have a longer lifespan, which is a good thing, right? We want that. But then that does increase strain on the healthcare system for chronic disease management, like you said, with diabetes or heart disease or dementia. And then you also have to think about the incoming population of physicians. Are they choosing geriatrics or primary care specialties to serve these populations, which I think is very important. And so I think shifting our focus from being a reactive system to one that is a preventative system is really, really going to be beneficial for everyone.
Yeah, so I look forward to you taking the charge on that. Yeah.
Oh, absolutely. First, I'll actually learn to wear sunscreen every day. I'll start with this with something small, right? I can't practice.
Exactly.
I can't preach what I don't practice.
And once you become, Surgeon General and stuff of the United States of America, then we'll see some changes. Okay, let's end today's episode with like four main tips. Let's say 4 main tips.
Yep.
So I got to say sleep. Sleep well.
Okay. I've got to say drink a lot of water.
Okay, sleep well, drink a lot of water. I'm going to do exercise.
I like that. I'm going to say what I said before, apply your sunscreen.
Okay, so that's it then.
Yeah.
And then the 5th one will be diet. That can go with water, I feel like.
Right? Yeah, I think we should do an episode on diet.
All right, confirmed. Episode on diet is coming soon. Okay, so exercise, diet, and water. I was going to say exercise again.
It's okay.
Sleep well.
Yes, sleep well. Yep.
Everybody got that down? Everybody's written it down? All right.
Everyone is ready to go.
Then that's all we have today. So catch us next time.
Yes. Thank you so much for joining us. And thank you, John, for joining me today.
Oh, thank you. Thank you even more for joining me.
Thank you for joining me today on our scheduled, verified thrice Zoom call, John.
Yeah, it was my fault. I had to cancel the last time.
Oh, no, that's totally okay.
Yeah, it's my fault.
Okay, how do I stop the recording? 'Cause this is...
Okay, I'll stop it.